during the pandemic, it's interesting, we had an opportunity to kind of spend a lot more free time thinking about what we do and actually spending time on education for the general eye community, because we were seeing less patients, we had more time off. And so we thought, let's pivot and maybe do a little bit more education. So one of the lectures that we did was called the Many Masqueraders of AMD. And there are many diseases that can mimic macular degeneration. Some are genetic. So there's diseases like familial drusen, a condition in which younger people under the age of 50 develop those deposits of fat and protein underneath the macula. We call them drusen. But they typically are not associated with vision loss at a young age, or sometimes even at a later age. There are certain inherited retinal diseases, diseases with known genotypic or genetic defects or malfunctions that can lead to diseases that look a lot like macular degeneration. One of those diseases is called Stargardt's disease. There are other diseases like cone or rod dystrophies or combined cone rod dystrophies that can look like AMD. And then there are diseases that are variants of AMD. So there's a variant of wet macular degeneration, most prominent in Japan, called polypoidal vasculopathy. And those patients develop blood vesicle growth from polyps underneath the retina within the choroid that can really look a lot like wet macular degeneration. But from a standpoint of epidemiology, they tend to be patients from East Asia and Africa, rather than the classic Caucasian or Chinese patient, which is kind of a variant on the theme of wet macular degeneration. So there are many things that look like it. Really, the diagnosis, the proper diagnosis, comprises of a few things. Number one, the patient has to be over the age of 50. So by definition, if you're less than 50 years old, you don't have quote unquote age-related macular degeneration. And then number two, we look for confirmatory findings on a type of imaging we use, something called optical coherence tomography. That is a really amazing technology in which we can visualize a cross-section of the retinal architecture at a level of about 3 microns. And we look for really hallmark signs of vascular change and anatomic change in the macula that is characteristic of the disease. And finally, a confirmatory test that we use is something called fluorescein angiography, or the less invasive, what we call optical OCT, optical coherence tomography angiography, which are basically methods to detect these neovascular membranes under the retina. So long answer short, there's many things that can mimic AMD, but we have a variety of testing we can perform right in the office same day to confirm the diagnosis.